Hi, hello, namaste, welcome back to our channel. My dear student, today's session about asthma. I can say this is a common condition where we can see in our India. So what is the meaning of definition? So asthma is telling that asthma is a chronic inflammatory disorder for the airway. As we know that, so this is a airway where the passage of the exchanging of oxygen and carbon dioxide. So where the inflammation occurs due to the inflammation of the airway, nothing but trachea, bronchus and bronchioles. So in that case, there is some kinds of episodes we can observe, such as wheezing, breathlessness, chest tightness, cough, particularly during the night and early in the morning. In that scenario is called as asthma. Let us see what is the incidence in our India. About 25 lakhs of the peoples getting suffer due to the asthma in every year. Whereas here it is telling among these peoples there is 30% is very high rate we can observe for the women. Compared to men, there is a 30% of the affected case we can observe for the women. We can see the diagrammatically, this is what I told, this is called as a pattern of the breathing. So this is a normal airway, so you can see the cavity here, the smooth passage of the airway we can observe. Whereas in the case of asthmatic condition, the airway will get narrowing due to the inflammation regarding some kind of the problem. So this is the thickening of the airway, it leads to breathlessness. That is, next one is common asthma attack triggers. So due to some triggers, the asthma may occur due to the air pollution or pest or cleaning products, whereas tobacco smoking, pet animals and more. So because of these triggers, may asthma get occur for the humans. Let's see what are the different kinds of the asthma. There is a extrinsic and intrinsic. Extrinsic asthma is called as due to the allergic reaction. If the asthma is getting, that will be called as extrinsic asthma. Whereas what is the meaning of intrinsic asthma? Non-allergic reaction leads to asthma, that will be called as intrinsic asthma. Whereas what is the meaning of nocturnal asthma? As per medical terminology, nocturnal is nothing but during the night, especially the asthma condition getting suffer especially during the night, that will be called as nocturnal asthma. And next one will be called as cough variant asthma. So here in the kind of the cough variant asthma, we observe the dry cough, especially the symptom we can observe the dry cough. So that will be called as cough variant asthma. Whereas next one is exercise induced asthma. So this kind of the asthma we can observe during only after exercise. The next one is occupational asthma. Yeah, so this is the factors, different kinds of the factors we can observe. Polluted factors, as I told you, one of the trigger is air pollution. So because of the pollutions, because of the chemical products, the asthma may get, that will be coming under occupational asthma. Whereas the last one is a mixed asthma. So different kinds of the causative factors, different kinds of the etiological risk factors may lead to the asthma, that will be called as mixed asthma. So these are the different kinds of the asthmas we can able to find out. Let us see what are the signs and symptoms for the asthma. The first one is on the auscultation. So what is the meaning of your auscultation? With the help of stethoscope, if you find out in the heart sounds or this lung sounds and all, the wheezing, the kind of wheezing sounds we can observe. Whereas the next symptom is dyspnea. Dyspnea is nothing but difficulty to do breathing. Whereas the narrowing, whereas the thickening of the airway, in that case we can't able to take the proper breathing, that will be called as dyspnea. The automatically the cough will be happen, the cough reflex will be the increased. And next one is chest tightness. So due to this kind of the things, the chest will feel discomfort and secretions may be thick and white and gel like mucus. And next one is expect the prolonged. So this kind of the signs and symptoms we can able to find out for the asthma conditions. So what is the diagnostic findings? How you can observe that the person is getting suffer with the asthma? As usually the common thing is history collection, you must take it, and physical examination and chest x-ray for find outing what exactly causes, and pulmonary function test is nothing but lung test and peak expiratory flow meter And next one is ABG is very important aspect to find out the asthma. That is nothing but arterial blood gases, and allergic skin test you must go for, and eosinophils count you must, and spirometry. So these are the different kinds of the diagnostic evaluations you must do to find out the asthma. So what is the management? There are the certain two kinds of the managements are there: pharmacological management, non-pharmacological management. The first one is pharmacological management. So especially anti-inflammatory medicines you must administer, because the special cause to get the asthma, that is regarding inflammation only. So your main goal is you must sustain, you must decrease the inflammation for the airway. So that's what you need to do, the anti-inflammatory drugs agents. So drug of the choice like oral prednisolone or methylprednisolone or hydrocortisone, a dry powered inhaler. These are the different kinds of the anti-inflammatory agents or corticosteroids you must administer to reduce the asthmatic condition for the human. Whereas what is the non-pharmacological management? There are certain conditions are there like breathing exercise, whereas the next one is yoga, meditation, and stress reducing techniques, and avoid the smoking and steam inhalation. So these are the techniques will helpful for the uh, freezing of the airway. So these are the non-pharmacological and pharmacological management. That's about today's session, my dear student. Today I have discussed about what is the meaning of asthma and what are the different kinds of etiological factors and causes and risk factors, whereas we have seen the pharmacological, non-pharmacological management also. That's about today's session, my dear students. Please like and share and subscribe. I will come for next session, and let's stay tuned. Thank you so much, my dear students.